sanitizer when in public and when touching multiple surfaces. Avoid contact of your hands to your face, especially in the regions of your eyes, your nose, and your mouth. Avoid close contact with seemingly sick individuals, particularly those displaying respiratory symptoms such as coughing, breathing difficulties, sneezing, and others. You may also want to keep your distance from those who may have had extensive travel history. Adhere to social distancing guidelines. When in public places, keep a distance of about 6 feet between you and others. Unless you are an essential worker, please stay home. And don't forget to wear your mask. It's up to you. Safety is of the Lord, but take responsibility for your safety and the safety of others.
chariots, by the arms of flesh, no man can prevail. No man, no man, no man, no man. My confidence is you. What is hard? What is hard for you? It can never exist. Oh, you do not lie. You do not fail. What is hard for you to do? It doesn't exist. No, it can never ever exist. Yeah. You do not lie. You do not fail. What is hard for you to do? It doesn't exist. It can never ever exist. It can never ever exist. God, you do not lie. You do not lie. You do not fail. What is hard for you to do? It doesn't exist. It can never ever exist. It can never ever exist. Those that know you and trust in you, not in horses or chariots, by the arms of flesh, no man can prevail. Ask Abraham or Sarah, or the woman with the issue of blood. Oh.
Hello. Here are some best practices to maintain health and wellness during COVID-19 season. Engage in regular hand washing using soap and water for at least 20 seconds. Use a generous amount of hand sanitizer when in public and when touching multiple surfaces. Avoid contact of your hands to your face, especially in the regions of your eyes, your nose, and your mouth. Avoid close contact with seemingly sick individuals, particularly those displaying respiratory symptoms such as coughing, breathing difficulties, sneezing,
So what do you think happened? Let's talk. It's interactive. Yes. Cardiac arrest, yes. So you saw he was playing. There was, they collided or there was collision there. Routine for football, right? And he fell, got up, and then went back. That's the emergency right there. What happened? There's no blood flow going to the brain. The heart stopped. Now, we talk about different organs in the body, but the body is one. We cannot separate one from the other. They all are supposed to work in tandem. If the heart stops, the brain cannot function. If the brain doesn't work, the heart may still beat, but you're not having that per se. Right? A lot of times when one organ is affected, the heart tries to compensate. And the heart is very, very, the way God created us, the heart is very strong. Very, very strong. It takes a lot for the heart to break down. And so for this to have happened, there must be a lot that's going on for his heart to just suddenly stop and go into an arrest. Okay? All right, we'll move on. Yes, sir. Great question. Great question. Thank you, sir. So we're going to still talk about that actually, but think about the function of the heart. This is, let's pretend this is the heart. So I'll use my left hand. Everybody please make a fist with your left hand and put it across your chest. That's where your heart is, and that's the size of your heart. Okay. So the heart is muscular, and it pumps and pumps and pumps and pumps. It cannot afford to stop. Now, for the heart itself to pump, it means that there's something that's keeping its muscles alive. So there are blood vessels that go to supply those muscles. Not just the blood that the heart itself is pumping. So imagine that you have, let me look at this bottle, and I'm compressing it from outside and pushing the water out. But the bottle itself needs something. If I keep pressing and pressing, there will be a time it makes noise, irritating noise, right, or annoying noise. And then at the end of the day, I'm not able to press it anymore because it becomes flat, because there's no recoil, because there's nothing to feed the bottle itself. So just imagine the heart. The muscle of the heart has blood vessels, 3 major ones actually. There are several small ones, but 3 major ones. And so if any of them stops or is blocked, I'm going to put this down just to explain. Nature wants to keep pumping, and now that muscle is dead, it can't pump, so it will overwork itself. It keeps overworking itself just to try to make it, thank you, just to try to keep pumping. And so when that happens, that part of the heart is dead. muscle dies off, and so the heart is not able to do its function. Now, that aside, I'm going to put that aside for a second. How does the blood that the heart is pumping and the blood that's coming to the muscle of the heart, how is it making it even function? Because there's an electrical system that's built into the heart. And so when the blood is going to the muscles of the heart itself says, oh, okay, there's this electrical function that says you have to move from here down through the whole of the muscle of the heart. It keeps moving like that. And that's what keeps the heart functioning, keeps it pumping. If there's any break in that electrical function, then the heart goes into abnormal rhythm, which we call arrhythmias. And that causes it to go into fibrillation, which means rather than giving me good pump like this, it goes. So you can imagine if the heart is flickering, like a flickering light. I'm not getting any light from that flickering bulb. I'm not getting any light. It's just flickering. Same thing, same concept. And so with the flickering, there's no blood moving. And so the blood doesn't go to the brain. It takes seconds for the brain to go dead. If the blood doesn't go to different parts of the body, it's just minutes before each of the organs fail. And so there is the part where it's the blockage, which causes heart attack. And there is the part that could be arrhythmias. Some of them those are two broad groups. Some of them could be congenital disorder. There are several other things that causes arrhythmias. But if you're looking at just two broad groups, two broad ways that they could happen, those are the main: blockage and abnormality with the rhythm of the heart. I hope that answers that question. We'll still talk about it. Praise the Lord. All right, I'll take the next slide. So what are the three common emergencies that we want to talk about? We're going to talk about choking emergencies. We're going to talk about stroke. We're going to talk about cardiac arrest. Next slide. And so choking is dangerous. It occurs when an object lodges in the throat or windpipe, blocking the flow of air. And if you can see the picture on the left, look at that red one. The second of the slide on the left. Look at that red. What's the tag on the red? Food. Okay. And so why is the food in the wrong part? If you look at the description of the parts, there's the trachea, which is in front. Please put two fingers, just put it in front of your neck like this. That's your trachea. That feels corrugated somewhat. That's the trachea. That's a windpipe. That's how air goes into our lungs. Now, the one on the back, the yellow that goes from the mouth to the back, in the back, that's supposed to go into the esophagus. So if you're eating and talking, the chances, because there's a little bit of a connection there, the chances of getting food run into the trachea or into the respiratory system is really high. And so you see what happened here. The food, instead of going in the esophagus, actually went in the trachea, in the respiratory tract. And so it's blocking air. He's trying to breathe, the air is not going anywhere. And what happens? Stops breathing. Heart doesn't get oxygen. The heart stops. The person turns blue. And that's it. Medical emergency. Okay? So, in adults, a piece of food is usually the culprit. Young children often choke on small objects. I mean, oh my God. Every little thing that he can find. Every little thing. You know those micro skills, the age where they're just developing, they pick anything and everything. Both in the mouth and the nose. It happens a lot. Choking is life-threatening because it cuts off oxygen supply to the brain. Give and get first aid as quickly as possible. And the reason I put give and get is, assuming you're the one going through it, you need medical attention immediately. If it's someone around you, you must give help right away. Next slide. So what are the signs of choking? Clutching the throat, and you can see this man, he is like so uncomfortable. Clutching the throat, it could be one or both hands. Neck or throat pain may occur. Inability to speak. They may breathe, or inability to breathe or swallow. Coughing, gagging. They may wheeze I've seen people actually wheeze through it in a hospital, strained or noisy breathing, squeaky sounds when trying to breathe. You know, it's horrible. It can be really bad. A change in color, especially in children, skin, lips, and nails change, turn blue or gray. Chest pain, a look of panic. They may not be able to talk, but you see that panic on the face, right away, attention. Shock or confusion, and then in some people, loss of consciousness. And we'll go to the next slide. So, what do we do in rescuing a choking victim? If a choking victim or person can cough forcefully enough, let them keep coughing. Hopefully, they'll be able to get it out. Coughing might naturally remove the stuck object. If a person can't cough, they can't talk, they can't cry, or laugh forcefully, then give first aid to the person. We'll talk about that. American Red Cross recommends the following steps. 5 back blows. All right? And what is that? It's 5. Your hand is positioned this way. Of course, this is a child. If it's an adult, you can't do that easily. If it's an adult, they stand. We'll work on the adult. Well, I'll show you how to do the adult. It's actually in that picture right there. And you want to push it forward, down and forward. So give 5 back blows, stand to the side and just behind a choking adult. And you can see the left picture. Look at him standing on the side and he's patting his back, okay? For a child, kneel down behind, place your arm across the person's chest to support, the person's body, bend the person over, the waist to face the ground, strike 5 separate times between the person's shoulder blades and the heel of your hand. Give 5 abdominal thrusts. If that does not work, then you go to the next one, which is the abdominal thrust. If back blows don't remove the stuck object, then give the abdominal thrust. Alternate between 5 blows and 5 thrusts until the blockage is dislodged. Any questions? All right. All right, we'll go on to the next slide. So, steps to help rescue. We talked about this. So, the reason I put this slide there is assuming, this is happening to you. What do you do? How do you position your hand? And that's what we see in that slide. Lord. All right. So let's see next slide. Okay. So that was the slide I was talking about. That's the hand there, and we have a video here. Can we take the video? And so the last sentence there says, "Always ask if they are choking and need help before you touch anyone." We're in a country where we have to be very careful. You don't offer help when it's not needed. So please, please, and please.
Having a meal with his son starts choking. Todd Hendricks and his 6-year-old son Anthony were eating boneless chicken wings when it happened. Todd took a bite and it went down the wrong way.
I was reaching for my drink and I swallowed again, and I was like, that's not good.
So what did that feel like?
Like you can't breathe, real fast.
His little boy wasn't sure what was going on and continued eating.
It's scary. You're looking at your kid, you're choking, you're blacking out. That's not fun.
Look what happened next. The guy sitting with his son at the next table sees something is wrong and jumps into action. Immediately, he performs the Heimlich maneuver. And if you think he knew just what to do, you're right. He's an off-duty New Jersey state trooper.
As soon as I heard the pound on the table, what I thought was, because I heard silverware shake, I just kind of looked back, and as soon as I looked back, I could see he was fully red. How are you? Come in, man. How you feeling?
We reunited Todd and Trooper Dennis Pillay today at the Buffalo Wild Wings restaurant where it all happened. They showed us how the life or death struggle unfolded.
I came behind him. His hands were already up around his neck, which made it real easy for me to get underneath and behind.
Now,
Give us
let's
a
watch
step-by-step of how to perform the Heimlich maneuver. I'm going to come around. I'm going to make a ball with my fist, the other hand, but first I'm going to feel where your solar plex is. I'm going to get right underneath it and push. And then you're going to make thrust going up, and it's going to push. You'll feel the, I don't know if you felt it, you'll feel the air. Right. So when you push hard enough, it's going to dislodge anything that's in there.
Useful information we all need to know in case you don't have a hero trooper at the next table.
All right, thank you. Okay, all right. Let's take a break for a second. I need a follow. Yeah. Thank you. Any questions before we move on? Thank you. Okay, all right. So we're going to switch gears. We're going to switch gears. Next slide. All right. So this is ischemic stroke. Please go back one slide. We went over it. So it was part of what was on the other slide. I just kind of went over it again and then the video. Yes, that's right. That's when I actually have each of us to do this to say, you know, try to resolve the pull. Oh, okay. Yes, what was the question about the chair? So, because it's being done on oneself, every force that you can get to make that effective would help. Yes, and that's actually the reason why I put that picture there. To say that, remember I said give or get. That if it's happening to you, you want to immediately, you know. So if this is not going to work because you're uncomfortable, then, you know, you may lean on the chair so that it helps give more force. All right? Thank you. So 5 alternate. 5 back and then 5 yeah. All right. Okay, we're going to move to the next slide. All right, so talking about ischemic stroke. And if you look at that picture far right, can somebody tell me what that tube is that has that yellow thing in it? It's a blood vessel, yes, it's an artery. So you could see the clot based on the labeling there. What is the yellow part? Cholesterol plaque. So as we age, cholesterol is made from the liver. Naturally, our body is going to make cholesterol. If we're eating a lot of food that, yes, and that's high in cholesterol, then we're making even more. So the body naturally has to have some cholesterol of some sort, and now we're adding more to it. And so when it has no place to go, it's going to be storing it somewhere. And so part of where it stores is in the lining of the arteries. All right. So that's an artery that's almost completely occluded by the cholesterol plaque. So one of two things could happen. The blood is trying to flow. It's not flowing well enough because the space that was supposed to be this big is now this tiny. So there's a lot of friction going through, all right? Because it's the lining is not the same as our outward skin. It's friable, if I could put it that way. And so when there's too much friction, it could actually sort of get bruised, if I could use that word. And so it becomes like a wound on the inside. So platelets, because naturally when we have a cut or any wound, your body wants to heal right away. It's going to get platelets to come there to come and stop it. Even the same on the inside. So when that happens, there's a lot of platelet rush in there to try to heal the wound. Now, it's not a good wound to have, especially in a place that there's so much occlusion already from the cholesterol plaque. And so the clot sits there because now the body's just naturally trying to say, I don't want this wound. Okay, that's created based on the fact that there's a huge blockage from, the cholesterol plaque. Do we understand that? Okay, so the other thing that could happen, so that's the clot. The other thing that could happen is with so much friction going on there, that cholesterol plaque itself could actually chip off and now fly straight to different parts of the body. The brain in this scenario, stroke. And so normal brain should not have that dark area that we see up there. I'm going to just flip this one. Okay, this is normal brain tissue. That dark that we see right there is not normal. That's the part that's occluded. Just like I was explaining with the heart. When the blood flow, see all the blood vessels? See those tiny red fanning out that we see there? That's blood vessels. When did they get occluded? Just like we explained with the heart. There's no blood flow, and the part of the tissue does what? Dies. And that's what we're seeing, that dark area there. Next slide. And so, just talking about data, it's a lot. It is a lot when you, yes, sir. So one of the first things that I learned about in medicine is never say never. So the way I would respond to that, in as much as I don't think it's been done yet, with the way things are going, they're ready to clone people. So brain transplant is like minute. If we're cloning a whole human being, brain transplant is just, it will be like that. But the difficulty or the challenge there will be the brain that's going to be transplanted. How are you sure it's healthy? Are you sure there's no cancer? Are you sure there's no illnesses and diseases there, to transplant? And there is very little room. All the other organs in the body, okay, they are, so to say, compared to the brain, easily accessible. The brain is the only one God made such that this covering, the skull, just protects it, separated from everything else. Think about it. Separated from everything else. The heart is in here, the lungs are there, everything is like, most of them are here. But the brain is separate and it's protected. Now, you have to cut open that skull to even do anything. And touching the brain, because of how, because of the amount of neurons that go on there, any tiny touch could actually cause significant damage. So that will be the challenge with transplant when it comes to the brain. But in the day and age we are with AI and all that's going on, never say never. I don't know. We'll see what the future holds. We'll see what the future holds. All right, so just because of time, stroke, there's treatment if you act fast. Look at the face. I need help. Can somebody read F for me? Uneven, asymmetry. A. Right? You try to say, okay, put your hands straight, and it's like that. Okay? S. And T. Call 911. Okay? So, facts. This is the next slide, please. This is still talking about, different facts, and I can share this slide. It's almost 800,000 people in the U.S. who suffer stroke every year, and about 140,000 die from stroke. Most important thing to know about stroke, the only proper response is 911. Get immediate medical attention. Immediate. The sooner, the better. All right, next slide. So, stroke risk varies by age. Risk of stroke increases with age. Early action is important. It is essential that you know and recognize the warning signs and symptoms of stroke so that you can act fast. The chances of survival are greater when emergency treatment begins quickly. Patients who arrive at the emergency room within 3 hours of their first symptoms often have less disability. When you look at data, 3 months past. Next slide. And so, useful acronym for stroke, be fast, that's what we read before. Balance, sudden loss of balance or coordination. Eyes, blurred vision, facial drooping, arm weakness, speech impairment, and then T. What is T? Call 911. Next slide, please. So, misinformation and misunderstanding, and I know we've heard, a lot of that in the last 3-4 years, right? Can lead to devastating outcomes. So we're going to review the following, and I want people to tell me if it's true or false. You were at work and a colleague experienced left-sided weakness and numbness for about 25 minutes and then felt better. So the question is this: if the symptoms have gone away, which, he said he feels better, you don't need to call a doctor. After all, his symptoms are gone. True or false? Why is it false? So we still need to go to the hospital. Thank you. All right. Strokes only happen to the elderly. True or false? Okay. Why did you say false? In the age, yes. It's more in the older people, but it could happen to anyone. All right. Strokes are painful. True or false? During the stroke or after? So you're talking about after, right? Okay, all right. So, yes, sir. In the chest. That will probably align more with the heart. That will probably align more with the heart than stroke. Yes. All right, and we'll talk about it. Next slide, please. Oh, sorry, sir. Stroke and right. We'll talk about it in just a couple of slides ahead, or a few slides ahead. All right, so myth and facts, okay? So if symptoms go away, you don't need to see a doctor. I think we all know that, right? That's wrong. We have to see. We have to follow up. So even if the symptoms have resolved, it may be a minor stroke. Like that bishop said, you don't know, the effect that it happened already. However, there is greater risk of having another stroke. So that may be an opportunity, like a warning sign to say you got a second chance, you got to go now. And if that person doesn't go, the second one may be worse. Small strokes don't need to be treated. That's not true. All right? Small strokes, depending on the affected area in the brain, may also cause significant deficit. Additionally, anyone with a stroke, small or big, is at higher risk of another stroke. Next slide, please. Strokes are not preventable. They are. About 80 to 90% of strokes can be prevented. And controlling blood pressure, making sure diabetes is controlled, cholesterol is checked, physical activities, lifestyle modifications, no smoking. I know none of us smokes here, but that's a big one for many people outside of here. And there is no life after a stroke. True or false? False. All right. There are several interventions and treatment, interventions now that, when done in a timely manner, actually prevent or limit, damages that could come. Restorative rehab is also very, very helpful. Next slide. Stroke only happens to the elderly. I think we talked about that. And strokes are painful. So, pain is not a usual symptom of stroke. However, like you said, people who have had strokes in the past, they may have neuropathic pain. They may have deficits and experience neuropathic pain. The only time that in the active moment that people could potentially have something that will be described as pain or headache is when it is a bleeding stroke. So there are two types of stroke. There's the ischemic one, which is the majority, more than 80%. And there is the bleeding stroke, people who have aneurysms, people who have brain bleed and causes deficits. That could be the worst headache of life. Immediate attention. Next slide, please. All right, so we're going to go to CPR and talk about the heart. We can take that video. I'll talk about it. So heat stroke is different from ischemic stroke. Heat stroke usually is due to heat. In the summer, when it's really very, very hot, most of the time, the elderly, they are affected. It could, it could definitely affect young people too, but it's dangerous. The only thing is, it's not as life-threatening as this one, but if you don't pay attention, people could die from heat strokes too, especially the elderly, the extremes of life. So very young children or the elderly. So immediate attention, make sure that in the summer, they'll ask us to make sure we check on the elderly, check on little children, make sure people are well hydrated, stay in the shade, especially people who work construction and work outside, like in the direct sun, just to make sure that they are protected. We have to take breaks from being in the sun when it's too hot. And any temperature that's going above 100 degrees Fahrenheit, you got to make sure you're not in there consistently for too long. So the temperature causes more of dehydration. So you're sweating out a lot, and so the body is trying to conserve the fluid it's losing. It's not able to. And so remember what I said about the heart. It tries to compensate. The heart always tries to compensate. So when it's not getting enough fluid or blood to move around, it kind of tries to shut down. And so the person feels faint. There isn't enough blood going to the brain because all the organs are trying to preserve, because the heart prioritizes the brain, if I could put it that way. The heart is going to say, I need to supply the brain. I need to supply the brain. And so in a situation where now the person has become really dehydrated, the temperature is so hot, not able to do what it normally will do, then things will begin to shut down. And being faint, that's it. The person passes out and becomes unconscious. I hope I answered your question. All right, so let's play that video.
Your heart has an electrical system that regulates your heartbeat and keeps blood pumping around your body. A cardiac arrest happens when a problem in this electrical system causes your heart to stop pumping blood. It's commonly caused by a heart attack or an inherited heart condition. Max wasn't aware that he had an inherited heart condition until he had a cardiac arrest while at work. The electrical circuit in Max's heart stopped working as it should. Instead of beating regularly and effectively pumping blood around his body, Max's heart quivered, stopping blood flow and causing him to collapse. This life-threatening heart rhythm is called ventricular fibrillation, or VF for short. Max will have no memory of collapsing, as the lack of blood and oxygen to his brain caused his brain cells to die, creating temporary memory loss. Max was unconscious, unresponsive, and not breathing properly. His colleague quickly called 999, and another began CPR. Chest compressions took over the role of the heart, which kept blood flowing around Max's body. Rescue breaths made sure oxygen continued to get into his blood through the lungs. Both were crucial for keeping Max's brain functioning. On the phone, the emergency operator instructed Max's colleague to find a defibrillator. They followed its instructions.
Press the pads firmly to the bare skin of the patient.
And delivered an electrical shock to try and restore Max's normal heart rhythm.
Shock advised.
However, Max didn't regain consciousness, so his colleague continued CPR. Paramedics soon arrived and transported Max to hospital for further treatment. Max had the best possible chance of recovery, thanks to immediate CPR that kept blood pumping to his brain and body. For more information on cardiac arrest, visit bhf.org.uk/cardiac arrest. BHF. Beat heartbreak from cardiac arrest. Beat heartbreak forever.
So essentially the next few slides is summarized in that video. CPR is summarized in that video. And I just wanted thoughts on what you saw in that video. Anyone? Electrical. Yes, exactly. The electrical activity. So if you look at that video, they were doing the compressions. They were doing the compressions. And the benefit of the compression is the blood is still flowing, not just to the heart, but even to the brain. Because what you want to make sure is the brain does not lose oxygen for more than seconds, just a few seconds, 6 seconds. After that, the brain could actually become a brain death. It could be an absent brain injury. And so if that happens, all resuscitative effort is like empty state. That's what you get in that person. So that's one huge benefit of the CPR. Now the electrical function of the heart itself, if you saw the, while they were doing that, the AED told them to shock because the AED sensed that there was abnormal rhythm. If you remember, I said there was the, where it's just fibrillating, it's just flickering. And so once the AED senses that, the AED can provide shock. The shock is what stimulates electrical activity to say you need to go back and function. So the hydraulic is what we're doing, if I could put it that way, and the shock, the AED, is what's delivering the electrical, the jolts, to come in there. So that both of them have to work together. It's not just the pumping. I could pump from today till tomorrow. If there is, arrhythmia, it won't happen. And that's why in the hospital setting, a lot of times, even though we do CPR and we shock, and some people don't come back. Some people don't come back because there's no guarantee that you're going to get that rhythm back. There is no guarantee. But you try your best and make sure you do it as fast as possible. Try to recognize as quick as possible and get that rhythm back. Okay, I'm not trying to scare people. Just knowledge is power. Once we know and we know why we're doing what, it makes sense and we can easily do it. All right, so because of time, I'm just going to skip through this. I think we all know this. Okay, Daddy actually asked me to talk about this. So, chest pain or discomfort. Now, a lot of times, heart attack or sharp pain. In fact, when people have sharp pain, it's probably more musculoskeletal. Maybe they hit their chest on something, or they carried heavy weight. When it is dull chest pain, sitting central, it comes on and off. Sometimes it may be persistent. That's not good. Immediate help. If it's sitting like an elephant is sitting on my chest, it's heavy. Pop 2 aspirins right away. Baby aspirin, just pop them in the mouth. And the reason is this. Remember, we're talking about the lining of the heart and, kind of the wound that's there, it's bruised, and the platelets are sitting there. Aspirin and some of these other medications are antiplatelets. So they will go to stop the effect of that clot. I'm echoing. And that can be very, very helpful and life-saving. Very, very helpful and life-saving. And so chest pressure, it's not going away, pop 2 aspirin. If it persists, don't even wait for anything. It's better safe than sorry. I would go get checked. I will tell you that I have been experiencing, I'm, literally young, and I like to climb stairs at work. And so I just realized that when I go up and down, I have this pain right here, and it goes in my back. I had to self-prescribe a cardiologist to myself. I'm like, you need to get me checked. Okay, because it was pressure, discomfort that was just sitting there every time I climbed the stairs, to the point where I get up the stairs and I'm like this, and I'm holding my chest. Okay, so it's really very important that we take good care of ourselves. Yes? Yes, so baby aspirin usually comes 81 milligrams in the United States. 81 milligrams, yes, ma'am. Good solution. Can somebody answer for me? Right. Thank you. Right. So in the immediate period when that is happening, anyone who has chest pain, stop the activity so at least you can get oxygen back to the heart. Not because oxygen is not flowing, but at least your heart is not overworking itself and you can breathe slowly and get oxygen in. Stopping though does not solve the problem. So I still have to look and go to the root of the problem. So what's the root of the problem? Because we should be able to climb stairs. We should be able, I'm not climbing 80 stairs, it's 4 flights. We should be able to. And part of, lifestyle modifications and what to do really is physical fitness. And that's part of what needs to be done. I'll be done soon, sir. Yes, sir. Yes, ma'am.
So is this the same thing that is responsible when people have do exercises and all of a sudden you just stop? Or they have not exercised in a long time and they are trying to start and then as they're running just drop and stop.
So, if they have underlying heart disease and a plaque ruptures during exercise, that's going to happen. That could very well happen. Now, the video of Hamlin that we watched, his is probably not a blockage or anything because they would have found it. His was probably more to do with the electrical function. But if there's a problem with the blockage, the blood is not flowing, yes, the person could potentially drop dead. Right there. Yes, ma'am.
Yeah, I just want to refer to the video we watched about the legacy carries.
Mm-hmm.
The first thing that was said about that guy was that he had a congenital
Heart disease that he didn't.
Now, supposed to be a 25-year-old person, a 15-year-old person, if that person has a congenital heart problem, anything can happen.
Yep.
So that is why we need to go to our doctors, right? To get children's
Thank you for that question. So I'm not sure that they don't have heart disease. It was not known, doesn't mean they didn't have it. So unless somebody has gone to get checked, that's the only way I can say maybe they don't have heart disease. And the reason why I'm not saying Hamlin's is heart disease is, as a sportsman, he's doing, medical checkup every now and then. All right. But even still, look at what happened. So anything could happen at any time. But there's so many of us who, if we were to ask everybody and say, when was the last time you went to your PCP, myself included? Because we keep going, we feel like there's no reason to go, so, But a lot of people walk around with heart disease. A lot of people. Now look at this picture. That's the heart, that's the vessel. Look at that yellow, the bubbles. He wouldn't know anything is going on because the heart keeps moving. It just keeps going. But it's almost blocked. And so any strenuous activity that takes a lot from his heart, and this forceful push of blood through that, and there's a rupture of plaque, what happens? The plaque blocks. And the next moment, the person is on the floor. Right? Okay. So the last sentence there, can somebody read that last sentence? Can you see it? Right. So women may not have typical symptoms like men. Shortness of breath is a major concern in women. They may not present with a typical chest pain, pressure, I'm uncomfortable. But if any woman tells you persistent dizziness that's not going away, medical attention right away. Yes, ma'am. Right. 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 Right, right. And that's what Pastor Bose was talking about, congenital heart disease. It happens in a lot of people. If it's known and there's appropriate medical attention, you do what you can. There is no guarantee, but you try your best. Yes, ma'am. So SOB is shortness of breath. I just wanted to shorten it here. So there's so many things that could make a person short of breath. Part of that could be, if I want to break it down into reasons from the lungs, if there's infection, if there is, say, blood clot, okay? If people have COPD, people who have smoked for a long time. Some people, it's not even smoking, it's just congenital disease, not congenital, but secondary lung disease that they acquire as they grow older. That could cause, lung disease. Now, when we're talking about shortness of breath, when we talk about what we all recently went through with COVID, most patients who had COVID, what was the first symptom? The major symptom was the shortness of breath because the virus was targeting the lungs, okay? And so, the exchange of air was difficult. And so people present with that. Other things that could cause it outside of the lungs could be if somebody is expressing like a heart attack, if somebody is expressing like choking, if somebody is expressing blood clot that comes from the leg and blocks the vessels that go to the lungs. A lot of things could cause shortness of breath, even asthma. So there's so many things that could cause shortness of breath. So in a woman who doesn't have a history of asthma, doesn't have a history of COPD, doesn't have any reason to be short of breath, but they're mid-age, 40s to 50s to 60s, and they're developing shortness of breath, dizziness, and there's concern for heart disease right away, because that may be a silent, sign, actually, of heart disease. I hope I answered your question. Yes, sir. Yes. You can move to the next slide. Mm-hmm. Could you use that? Yes. Mm-hmm, mm-hmm, mm-hmm. Most people have baby aspirin at home. That's why I said just pop 2. Any aspirin is fine. Any aspirin is fine. Even in the hospital, somebody comes in, chest pain, the first thing I grab is just give them, aspirin. Chew, if you can chew it, yeah. Okay, all right. So, yes, sir. So if you don't have baby aspirin, any aspirin that you have suffices. Any suffices, it's okay. The difference between 81 and 325, there is no data to say that 325 is better than 81. Like it's not, if it's not, there's no significant difference whether you take the baby or you take the 325. That's why they encourage that just you have the 320, the 81, just take the 81. That's fine. Yes, ma'am. Right. Right. 81, yes, and that's what I'm saying, that there's no significant difference when you take the 81 or 325. So if you're getting the same benefit from the 81, why take higher dose? Right? Just keep to the 81. Yes. Abdominal pain, discomfort, they're just not themselves. Not necessarily so. Chew, yeah. Okay, can anybody answer that question? Great question. What about if I swallow? How? Why? Helps digest faster, and so it's absorbed faster. That's the difference. Because if you swallow, it's going in the stomach, so before it's processed in there, so to say. But if you chew it, it gets absorbed right into the system immediately. That's just the difference. That's just the difference. Under the tongue, yeah. Yeah. There are some medications that you just do sublingual. This is a chewable one that tastes okay. Yeah, yeah. All right, so let's move on. So, next slide. Yes, ma'am. Okay, everybody raise your left hand, please. Put it across, make a fist, and put it across your chest. What do you have there? So this is on the left side. So if I'm getting pain here, okay, although some part of it comes in the center, but I'm getting pain here, and it's referred around here, or it's going to my left arm, it's probably coming from the heart more than anything else. If it's on the right side, it's less likely the heart. It doesn't say absolutely not the heart, but less likely. Does that answer your question? All right. Okay, so time is appropriate medical attention and treatment within the first 90 minutes of a heart attack significantly increases the chances of survival. Taking an aspirin tablet while waiting to get medical attention can lower the risk of clot formation and decrease risk of death from heart attack. Next slide. So what to know about heart disease? Sit the affected person in a comfortable position, call for help. 911 if deemed necessary or appropriate. If breathing isn't normal or the patient is not responsive, CPR may be necessary to increase or double the chances of survival. And this is where we're going to try to do some activity here. And so, next slide. Yes, sir. Go back one slide. Mm-hmm. So, what this means, if they're not responsive, because if you see someone, they're not responsive, but they're breathing, then you don't have to really go jumping on their chest. But if they're not responsive and you see they're not breathing, then that triggers, uh-oh, there's a problem here. If they're breathing, most likely they have a pulse. All right, let's move on to the next slide. So, can I get help? Can people help read this? Somebody read the left one. Thank you, sir. Another person, the right one.
When you do CPR, you are helping to keep the blood flow active, and this can be life-saving as it increases the chances of successful resuscitation when expert medical help becomes available.
All right. We're going to take a few myths, and then we'll do CPR. Next slide, please. So if you have heart disease, you need to take it easy. True or false? Next slide. If you have heart disease, you need to take it easy. Think about it. Remember, I got a question to say, well, you're having chest pain. Why didn't you just stop climbing the stairs? Alrighty. So, we want to avoid, look at that first sentence there. Sedentary lifestyle is not the best and may be dangerous actually for the heart. So it can lead to overall decline in physical condition, and some people may develop blood clots. And so, in as much as we're thinking, I should take it easy, you actually need to still be active. Just not overstretch your heart or do something too strenuous. All right? So, recommendation there, discuss with your healthcare provider about appropriate physical activities and exercises for you. Walking is a simple, non-costly, less demanding exercise that's good for the heart. Walking. Just tell yourself, I'm going to walk 1 mile a day. All right? And take time, walk 1 mile. You don't need to go to a field to do 1 mile. If I want to do 1 mile in here right now, I go around here maybe 8 times or 10 times, and I will have 1 mile. As many times I need to just go around in here, my 1 mile is done. All right? Okay, next slide. So the next slide, you can eat anyhow or eat anything if you take a cholesterol-lowering medication. True or false? Okay, why? Cholesterol is from food that we eat, and also the liver will make some. Cholesterol-lowering medications like statins reduce the amount of cholesterol that's made by the liver. So it doesn't have too much effect on the one you're taking it. So if the body is making some and the medication is helping to lower that, and now we're adding more, right? Work done is 0, right? And so that's where lifestyle modification diet comes into play, all right? So blood levels of cholesterol reduced and the amount deposited in the arteries also will decrease. Next slide. The third one we're going to talk about, it's okay to have higher blood pressure when you're older. Okay, why not? It's never good. It is never good. So blood pressure tends to rise with age just because the arteries become older, stiff. And so stiff arteries make the heart, pump harder, and with blood pounding against the artery walls persistently over time, it causes damage which may be irreversible. Also, overworked heart muscle becomes less effective and thus has to pump harder, and that causes problem, increased demand on the heart. We'll move on because of time. Next slide. Heart disease is really a man's problem. Women don't have to worry. True or false? Completely false. Completely false, all right? So I'm just going to read the recommendation. Actually, the second to the last. By retirement age, 70% of men and women have cardiovascular disease, which includes coronary artery disease, heart failure, stroke, and hypertension. Risk continues to rise, okay? And by age 80, 83% of men and an even higher percentage of women, 87%, are affected. So it's never true that it's only for men. Next slide. A small heart attack is no big deal. True or false? Heart attack is heart attack. It's horrible. It's not acceptable. Should not happen. If it happens, pick up and make sure you avoid another one. Recommendation. Discuss with your healthcare provider about ways to minimize your risk of heart attack, such as weight loss, cholesterol control, and blood pressure control. Seeing your healthcare provider regularly is helpful to keep your heart on track and to address any health issues. And so we're going to watch this video. Next slide. And we're going to do some CPR exercises. Simple steps to save a life. This is a longer video. I think it's about 4 minutes. But we're going to round up soon. Thank you, sir.
In this health sketch, we want to talk to you about CPR, which stands for cardiopulmonary resuscitation. We use CPR when someone has collapsed and is not breathing, because it can keep people alive until emergency services arrive. Learning these simple life-saving skills is as easy as ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulders and ask them loudly, "Are you all right?" If there is no response, you need to. S. Shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. And try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful, as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when the heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the center of the person's chest and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second. And hard means that the chest needs to go down by about 5 centimeters. This might sound a lot, but you do need to push hard for it to be effective. If you have been trained, you can give 2 rescue breaths after every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, just keep going with hands-only continuous chest compressions. If someone else is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person is definitely breathing normally. Sometimes we can add another step. D. D is for defibrillation, which is about delivering a shock to restart the heartbeat. Some public areas and workplaces have an easy-to-use defibrillator on site called an automatic external defibrillator, or AED. Automatic means that it is the machine that decides what to do, so you can't go wrong, and it even talks you through the steps. If there is no AED available, keep going with CPR until the ambulance arrives. That's it. So to recap, remember doctor's ABC, and if you have it, D. That's D for danger, R for response, S, shout for help, A for airway, B for breathing, C for circulation, and D for defibrillation. In this health sketch, we've shown you the simple steps you can take to help someone who has collapsed, is not breathing, or not breathing normally.
So interlock your hand. So we interlock, we put in the center, and elbow straight, and we push down, down. How many centimeters down? 5 centimeters. How fast should I go? So 100 to 120 in a minute. So let's use 120. 120 compressions in 60 seconds. That means in 1 second, I have to have done 2, right? So, all right, I'm breaking it just because we're explaining. I should not be breaking it. But what I want you to see, you look at this while I do it,
Okay.
all right? What color do you see there now?
That's the yellow,
Okay.
green,
All green, right?
all green.
So assuming I was doing this,
No impact.
no effect. Thank you. Okay, all right, you want to try? So you could look for yourself and see how effective it is.
Okay.
All right, let me reposition it for you. Okay. So elbow straight, move closer, and down, press down. Okay. 2 green. Go, just keep going. All right, let's go do it on there. I think it's going to be easier. So get ready. We're just going to be picking on somebody. We're going to pass it. All right, Sister Michelle, please come. All right, please stay here. All right. So all have to be green. Interlock. Press down. Elbow straight. Good. Okay. All right. And then you go to the next one. All right. Good. Pick somebody. Pick someone. Just pick anybody.
Okay. Minister Young.
Okay, you're coming here next. Sister Michelle, come here. Sister Young, I'm going to start over there. So all of this is good to measure because it gives you the color. All green. All green. somebody. So all green, you want all green. So if one of them is orange, you look at which one is orange.
Papa, too, poor kid.
So the belief is talking about the recoil, like how deep we go from trees. So like a straight wall that's just coming down. So you believe that the depth is what marks the this down.
Okay. Left.
It's better, but if the other one is different, it doesn't matter. Yes. Move closer. Move closer. Because you can use your shoulders to push down rather than your back. Okay, you feel comfortable? Okay, let's go to this one. All right, please, somebody. Hey, it's believe. Straight. This straight. Straight. Like this. Okay. And press down. Move closer. And press down. This is still bent. Okay. Okay. All right. Good. Are you green? Satinu, are you green? Two green. Okay. All right. Next, next slide, please. So while we're practicing, this is just a summary of what we saw in that video. Call 911 or designate someone. Determine if victim is responsive or not. Shout and ask, are you okay? If no response, tap on the shoulder, ask, are you okay? So I'm going there. Are you okay? I look at them, they're not, their chest is not right, so they're probably not moving. I'm looking at it, I get ready to go. Right away, as soon as I see them responsive, please call 911. So I go, Pastor Lana, please call 911. And are you okay? Are you okay? No response. I start. I check for the pulse, but they're not responsive, and there's no pulse. All right. If no pulse, then start chest compressions. Next slide. Before starting chest compressions, make sure to lay the victim flat, and that's what we did, on the back. Position yourself to the side, interlock the fingers, lock your hands in a straight position at the elbows. Next. Get help, 911 or designate someone to call. Do not delay in starting CPR. Time is of essence. Remember, need quick and strong chest compressions. Compress 2 inches or 5 centimeter deep. Can somebody show me 2 inches? Okay. Usually this first finger, it's about that, yes. All right. Allow for complete chest recoil. And why is that important? That shows that it's effective compressions. Pastor Bosse was going to say something. Mm-hmm. To allow for recoil. When you're doing it, you're doing a 1 and 2 and 3 and 4. So that end is the recoil. Because you want the heart to refill itself and go down. Right. Thank you. Minimize interruptions and compression. However, I tell everybody this: if you're tired, it's okay to say, "I'm tired." I would rather get help than the person who's trying to help now ends up in medical emergency. Ratio of compression to ventilation is about 30 to 2, but now before the mouth to mouth was a big thing. Now, if people are not comfortable, we don't even talk about, that. But in the hospital setting, we do the breathing part of it. Next slide. Effective chest compressions are needed. So this is, we're almost done. So AED, I think we saw this in the video. Any questions about this? Any questions about this? So the defibrillator, when activated, sends a shock through the victim's chest to stop, any arrhythmias that could be life-threatening so that the heart could go back into his normal rhythm. AEDs are life-saving and are designed for ease. So it's not like it's something abstract or that we can't use as long as you're able to follow the instructions. Yes, ma'am. Right. That's the whole goal. And that's part of why we're doing this. It is made so easy that anybody can use it, and you just follow the instructions. So it's going to give, a couple of the videos that we watched, it gives the instruction. It just says, apply the pads, you put the pads in. It's going to tell you how to put the pads, or there's a picture somewhere in there in the package, and you apply it. So it kind of reads through the arrhythmias. If there's any arrhythmia and it's life-threatening, it's going to give the instruction shock. And so when it gives the instruction, the only thing is, do you want to put your hands on somebody that's getting electrically shocked? Absolutely move back. That's the only thing that we all have to know. So even though it's available and anyone and everyone should be able to use an AED, if you're not comfortable, you could say, I'm not comfortable with this. Somebody else please take over, and people will do it. But it's so easy. It's just place the pads and follow instructions, and it goes on. All right? So something that I just wanted to, and this is courtesy of Dr. Fagbemi, actually. Next slide. The Good Samaritan law. And I thought it was, good that we talk about this. So, Good Samaritan, we all know what a Good Samaritan is. And if, say, you're at work or you're going somewhere and something happens, you're kind of like, I'm a chaplain. Should I be doing something here? And you decide, you know what, I'm going to do it. Then, this law is supposed to be protective of that person who is being a Good Samaritan. The essence of Good Samaritan legislature in most jurisdictions is that bystander acting in good faith, attempting to perform first aid or CPR, rescuing a rescue using an AED cannot be held liable if anything happens, for unintentional harm. So that's the law right there. Now, I'm going to add to it. Next slide. And just for us to see that it's not just enough to say, I want to do it or I want to help. I'm tired now, I'm going to stop. No can do. Once you start, you have to finish. So that's the duty to act that comes sort of along with the Good Samaritan law. So the law defines duty to act as a person using any available remedy to prevent harm from coming to an individual person or the public at large. For instance, it's a parent's duty to protect their children. I'm going to skip that. Now, as per the Good Samaritan law, an individual creates a duty to act by voluntarily inserting himself into a situation, by assigning responsibility. Once you start, you have taken that responsibility. And so the duty to act says you can't stop. You must make sure everything, you finish it. It doesn't mean that you'll be able to revive the person, but you can't just say, oh, I've done 10 compressions, I've tried, I'm leaving. No can do. We got to get help. Yes, ma'am.
I have a question for you. I understand all of this. But say, for instance, it's just you and that person.
Right.
Now, if you get tired while doing this, what happens with this?
You call 911, and 911 is walking you through. They're walking you through on the phone what to do. And as you're tired, you tell them, I'm getting really tired. What do I do now? You let them know. Because there should be response within minutes, like within a few minutes. You don't stop. You keep going, but make sure there's, communication with help. Yeah. So the example that they put here, this is from Legal Dictionary. I just kind of put it up there. Look at the second to the last paragraph. While on her way to a grocery store, Amanda comes upon a crowd of people gathered around a man who fell from a scaffold. Amanda is an EMT by training, so she stops to render aid. She chooses to roll the man over, then has someone help her drag him closer to the building so people can pass. Good Samaritan, right? She didn't have to do it. Did she help him? What is dangerous there? The person fell from a scaffold, especially the neck bone. So now with the movement, with her help, we're not sure whether the danger or the broken neck is from the scaffold or from dragging. And so it turns out that the man had fractured his spine, moving him, and severed his spinal cord. And so just that move worsened the fracture, and he lost function of his spinal cord and became paraplegic or quadriplegic. And so now, is the Good Samaritan law going to protect Amanda? No. No. So and the reason that it doesn't protect her is she's a trained medical personnel who should know better. And so if one of us say, chaplain, we're not medically trained, and that happens, do not drag. And that's why you gotta, do you need help? Am I able to help? If you're not able to, just call 911. Get help. Get appropriate help. Yes, ma'am. Mm-hmm. Yes. Yes, you could help. And the last one on that next slide, please, is the duty to remain. And that's what I was talking about before. I'm just going to read the example. Tommy is eating at a diner when he notices Daisy is choking on her food. He makes his way over to her table and begins performing Heimlich maneuver. Because Tommy has already begun an attempt to save Daisy's life, he now has a duty to act to complete his rescue. Therefore, if he gives up trying to help her and she dies as a result, he can be found legally responsible for abandoning her. So, he tried, it's not working. Does he leave? No. 911, wait until help arrives. So the reason I put that there, not to scare us, but just to say, if you're gonna help, make sure you know, I can do this and I'm ready to do this. But don't do it alone. Always get help. 911. 911. So, rounding up, next slide. Rounding up, and we're still gonna do, we're going to take turns just so that everybody can touch the mannequin. Time plays a significant role in our life. Time helps us make good habit of structuring and organizing our daily lives. Time and tide wait for no man. So when it comes to medical emergencies, please, please, and please, time is of essence. Next slide. So take home points. Medical emergencies occur frequently. Be ready to act so you can save. Time is life. Heart disease leads to heart attack, which also can lead to cardiac arrest. Stroke can be devastating. Don't be afraid to help, however, ensure you get medical expert support as soon as possible. Nobody knows how much time they have. People can die at any age, at any time. However, as believers, we have God. All right? We've got the covenant of life, right? And so we just have to do what it takes to make sure that, we set a template for God, for his promises to come to fulfillment in our lives. Amen? All right. So let's go practice this. Next slide. And I added these 2 bonus slides for the chaplains. Next slide. All right. So health is your asset. This is for us here. All that we've been talking about is really to help other people, right? But this is particularly for you and I. Health is your asset. You must invest in it. Amen? Live a healthy lifestyle. There are certain food that we should not be eating. There are some that, you know what, you just feel like spoiling yourself. I love ice cream. Do I eat it every day? No. But when I want to, I take some. All right? It doesn't mean don't enjoy, but you just have to be careful and do everything in moderation. Well, if the day is in control, right, Mommy Bishop? I'm going to defer that question to Mommy Bishop. What about it, sir? What about it? Follow a healthy diet plan. Prevention is always better than cure. Avoid sedentary lifestyle. Make sure you exercise. And what is the easiest form of exercise? Walking. You can take charge of your own health by being very, very proactive. And the last slide please, or next slide. So do your best to ensure the following: heart health diet or healthy diet. Make sure you take your medications if you prescribe medications. Make sure you follow up with your doctor. Make sure you maintain a very healthy weight. One of the easiest ways to know your weight, your healthy weight, is know your height. Go on Google and do BMI, body mass index. If you put it in and put your height and your weight, it's going to tell you whether you are normal range, overweight, or obese. If you're more than 30, that means there's work to do. Do not crucify yourself. No, there's no need to. All right? As I am borderline overweight. I am borderline overweight for my height. And so what do? I have to make sure I keep this weight or lose some. And so the fasting and prayer worked for me. Praise the Lord. Blood pressure has to be in healthy range. Cholesterol level within acceptable range. Please follow up with your doctor. Adequate sleep. Please do not joke with that. We're not getting younger. The body needs to reset and it needs more time. So you have to sleep minimum of 8 hours. If you cannot afford 8 hours, at least make sure in between you rest really well. Emotional and mental well-being, that's very important, and stay physically active as much as possible. And the final slide, thank you. Thank you for your time, for your attention. Thank you very much, sir. So I'm happy to take questions, if any other questions. And for those who have not done the CPR, please come on the mannequin and we can still do it on the side.
Praise the Lord. Praise the Lord. Thank you so much, Brother Kolade. God bless you. We can stop our transmission now. Now,